Good morning. Today we are discussing about combination syndrome. Coming to the introduction, prosthetic rehabilitation of patient with a complete edentulous maxillary ridge and partially edentulous mandibular ridge with the presence of anterior mandibular teeth has been challenging. According to the Kelly, reported that treating this situation with a complete denture for the maxillary arch and the class 1 mandibular removable partial denture results in the series of destruction chances in both the arches. This is termed as combination syndrome. For this phenomena, the characteristic features that occurs when an edentulous maxilla is opposing by natural mandibular anterior teeth includes loss of bone from the anterior portion of maxillary ridge, overgrowth of the tuberosities, papillary hyperplasia of hard palate mucosa, extrusion of anterior teeth, and loss of alveolar bone and ridge height beneath the mandibular removable partial denture base. Common causes for bone resorption is underlying systemic disease, local systems like trauma and shear. Definition of combination syndrome: the characteristic features that occurs when the edentulous maxilla is opposing the natural mandibular anterior teeth includes loss of bone from the anterior portion of the maxillary ridge, overgrowth of tuberosity, papillary hyperplasia of hard palate mucosa, extrusion of mandibular anterior teeth, and loss of alveolar bone and ridge height beneath the mandibular removable partial denture called as anterior hyperfunction syndrome. Characteristic changes in combination syndromes are loss of bone from the anterior part of the maxillary ridge, overgrowth of the tuberosities, papillary hyperplasia in hard palate. Extrusion of lower anterior teeth, the loss of bone under any partial denture bases. According to the Slander et al., later discussion of 6 additional sciences associated with syndrome that includes loss of vertical dimension of occlusion, occlusal plane disturbance, anterior septal repositioning of mandibular, poor adaptation of prosthesis, epilis fistula, periodontal changes. Bone loss of maxillary anterior teeth enlarges tuberosity, sequence occlusal plane disturbances, sequence extrusion of lower anterior teeth that results bone resorption under lower removable partial denture. This results combination syndrome. Histopathology: mature, dense, fibrous connective tissue, dense bundles of collagen fibers, few cellular and inflammatory cells, avascular, overlying normal epithelium with some evidence of hyperplasia. Prevention of combination syndrome: retained weak posterior teeth are abutment by means of endodontic and periodontic technique, endosseous endodontic implants, and amputated of one lower molar root to presence the other as an abutment, and overlying denture on the lower may avoid the combination syndrome for developing. Overlying denture utilizing the lower teeth roots for stabilization provides a complete denture occlusion. Correction of changes in basal seat: surgical can be done. The flabby tissue can be removed. The papillary hyperplasia can be eliminated. The enlargement tuberosity can be reduced. Reduce the displaced force and maximize the retention forces. Displacing forces are reduced by the coordination the maxillary teeth and maxilla plane of occlusion to harmonies with mandibular teeth during mandibular movements. Nil in the occlusion. Described morphology maxillary occlusal surface are generated intraorally. It is extremely important that lower partial denture to be fully extended and covering the maxillary maximum area possible for support of partial denture bases should help to prevent the combination syndrome. Covering the retromolar pad where muscles and raphe attached prevent to reduce resorption, and covering the buccal shelf is necessary to retain the bone loss. Maxillary ridge resorbed in relation to the mandibular status. According to the Carlson, a complete maxillary denture resorption in relation to mandibular denture, complete denture, anterior mandibular teeth, and class 2 mandibular removable partial denture and natural mandibular teeth only. According to Carroll's, complete maxillary denture resorption related to no removable partial denture, class 1 mandibular removable partial denture, removable retained by bar splinting with crown. Australian Implant Center. According to Australian Implant Center, the maxillary complete denture resorption related to the implant retained over denture fixed implant supported process. Papillary hyperplasia of hot palate mucosa, extrusion of mandibular anterior teeth, bone resorption under mandibular removable partial denture. Limited number of studies of accepted quality, no epidemiology study, no random control trials, no prospective studies. Other causes for the signs, other characteristic signs rarely seen. Pathophysiology. The early loss of bone from the anterior maxillary is the key of the other chance. The lost bone is replaced by the flabby tissue, which does not provide adequate support for the maxillary denture. The posterior maxillary ridge becomes larger than with the development of enlarged tuberosity. This is attributed to the development of negative pressure created by the upward movement of the anterior ridge. Combination syndrome does not meet the criteria to be accepted as medical syndromes. The sign feature associated with the combination syndrome exist, but to that extent or in which the combination syndrome has not been clarified. However, other research conclude that 1 in 4 patients treated with maxillary complete denture and the bilateral distal extension mandibular removable partial denture exhibit alveolar ridge changes consist with those described in definition of complete combination syndrome. A possible treatment plan for the situation includes extraction of the lower teeth and rehabilitation with implant supported overdenture. Implant supported overdenture provides the reliable and predictable treatment outcome for the now resorption mandibular ridges. Most persons wearing implanted retained overdenture are satisfied with treatment results. Implant supported process exert biting forces with comparable to the natural dentition. Improved chewing function and increased the bite forces have also been recorded after implant treatment. Similar biomechanical situations to be distal extension removable partial denture is created with mandibular implant supported over denture. Research has been shown that in subjects with implants mucosa supported over denture, complaints of loosening of mandibular denture correlated with the decrement of residual ridge width. There is the five, according to the Kenley, five changes can be seen in bone resorption in anterior maxillary ridge, overgrowth of tuberosity, papillary hyperplasia, extrusion of lower anterior teeth, mandibular bone resorption. This is the typical clinical changes in edentulous maxilla. According to the Sender et al., 6 additional changes: the loss of vertical dimensional occlusion, occlusal plane discrepancy, anterior repositioning of mandible, Epilepsy fistula, adverse periodontal changes. Mechanics of damaging to maxillary foundation, inadequate denture base extension, failure to restore the lost tissue, failure to use functional impression techniques, inadequate direct retention, inadequate indirect retention, inadequate stability. Mechanism of damaging to the maxillary anterior ridge, fulcrum line in cuspal and bicuspal region. Maxillary denture moves upwards anteriorly and downwards posteriorly. Negative pressure posteriorly to the fulcrum line. Systemic and dental consideration, diabetic and osteoporosis, inflammatory process, caries, susceptibility, periodontal status, oral hygiene, ability retention and guide planes. Similar changes also seen in angles castry, jorulation, unreplaceable mandibular posterior teeth, parafunctional habits, improper occlusal scheme. Prevention is better than cure. To avoid the combinations, extracting lower anterior teeth is not a advocate. Retained weak posterior teeth as abutment, use of endosseous implants and hemisection. These are the impression procedures for combination syndrome. Extra relief can given with double spacer, border molding done. After that, holes made in the anterior region for excess material to flow, prevent the pressure build-up in anterior region. Impression procedure with light body silicone. Linear occlusion, according to the gloss of prosthodontics term, linear occlusion, occlusal arrangement of artificial teeth as viewed in the horizontal plane. However, in the masticatory surfaces of the mandibular posterior artificial teeth have been straight, long, narrow, occlusal from resembling that a line usually articulating with opposing monoplane teeth. Chewing pattern, chewing cycle becomes even more teardrop, decreases in number of chewing cycles. Important aspects of treatment, recording the impression that satisfy the parameters of support, retention and stability. Creation of appropriate occlusal forms, informing the patient of his and her contributing the denture success. Coming to the treatment plan, surgical considerations, reduction of enlarged tuberosities, bone graft in anterior maxillary ridge, implant placement, prosthetic considerations, recording the definite impression restoring the loss of vertical dimension, restoring the occlusal plane, shortening the denture arch. Coming to the conclusion of this class, the discussion, the potential harmful effect of the mandibular implant supported over denture when opposed to the maxillary complete denture. The situation miles the symptoms of combination syndrome. The treatment plan for the suitable is also discussed.